Good afternoon, Chairman Collins, and thank you for the opportunity to talk today about OIG's efforts to combat medical identity theft in Medicare. Medical identity theft can create patient safety risk and impose financial burdens on those affected and may also lead to significant financial losses for Medicare. Of concern are external threats posed by criminal enterprises and professional identity thieves, as well as internal threats from company owners, employees, practitioners, and patients who participate in these fraud schemes. Combating medical identity theft is among OIG's highest priorities. OIG advances our mission through a robust program of investigations, audits, evaluations, and compliance efforts. Combining data analytics with field intelligence, we identify areas most vulnerable to fraud and deploy our resources to ensure the greatest impact from our work. OIG works closely with the Department of Justice, CMS, and other federal and state law enforcement partners to bring those who commit fraud against our program and beneficiaries to justice. Our Medicare Fraud Strike Force teams, located in 9 cities throughout the country, exemplify this approach. The OIG and our partners are committed to fighting and preventing fraud, waste, and abuse. Our efforts have produced significant results, including over 4,300 criminal and civil actions, over 11,000 exclusions, and nearly $11 billion in investigative receivables in the last 3 years. Since 1997, we have recovered more than $27 billion to the Medicare Trust Fund. Despite these successes, more needs to be done. Fraud schemes are constantly evolving and migrating. Identity theft is now a common component of many fraud schemes we encounter. The patient and provider identifiers represent the keys to Medicare reimbursement, and as a result, both are targeted for identity theft. We've seen a variety of identity theft-related schemes in our enforcement work. Our cases include company owners that pay kickbacks to identity thieves for patient information, healthcare providers that steal the identity of another practitioner, and patients who participate in fraud schemes by selling their sensitive data for some sort of monetary gain or kickback. Annual Medicare spending is approaching $600 billion. An estimated 10,000 individuals become newly eligible each day. As the program continues to grow and evolve, criminals will continue to target the Medicare program for fraud. The need to protect the beneficiaries it serves from identity theft has never been more important. It will take an all-hands-on-deck approach. This includes targeted enforcement, such as our Medicare Fraud Strike Force teams, and collaboration with our external partners, including our program integrity and private sector contacts. It is also critical that we continue to educate our seniors so they can take steps to avoid being victimized by identity thieves. I would like to commend the Senior Medicare Patrol for their efforts in this area and express our commitment to work with the SMPs to educate seniors about identity theft. We'd also like to thank Congress for your efforts to prevent medical identity theft, including this important hearing and recent legislation that requires the removal of the Social Security number from Medicare cards. We appreciate your sustained commitment towards our mission and your interest in this vital issue of protecting our seniors from identity theft. Finally, we encourage seniors to notify OIG's hotline if they suspect the fraudulent use of their Medicare number, either by visiting our website or by calling 1-800-HHS-TIPS. Thank you for the opportunity to speak with you today, and I would look forward to any questions you have.